Hi guys, this is Ryan Holleen from Seaport Spine. Today's video is for people who unfortunately think they may have injured a lumbar disc or a disc in their low back. And we're going to talk about the most common presentation for a low back disc injury. So this person is typically flexion intolerant, meaning they're having trouble with activities such as sitting or bending forward, touching their toes. They may be having sciatica. So I have a little disc model here to kind of show this. Oftentimes, this type of disc injury is a posterior disc injury. So this is the front of the spine, it's the back of the spine. And as you can see here, this model is showing a disc bulge. And say this person was to bend forward, flex their spine, it would cause increased stress on the disc. And this could very well cause a dynamic disc bulge to grow and put pressure on the nerve. And this could be, this is a common example or diagram to show where someone's sciatica symptoms are stemming from. So one way to check to see if this could be your issue, we're going to give you the tummy lie technique. This is a position of relief, but it's also a self-diagnosis technique. So next time you're having really bad low back pain, maybe really bad flare-up of sciatica, try this technique. And if it feels better after you do it, it's a very strong sign that you are a flexion intolerant, posterior discogenic back pained individual. So start from standing. So you're not going to want to flex the spine again. If you are flexion intolerant, you don't want to round the low back going from upright to laying down. So instead use a lunge pattern like this. Go onto your knees, do a hip hinge, and then walk the hands out. And then extend on one side, extend on the other. Now, the technique, the name pretty much says it all, a tummy lie. It's very similar to McKenzie extension exercises. It's basically a safer version of McKenzie extension exercises. So you have three options for hand positioning here. Two hands flat, chin on two hands, one hand flat with a fist, chin on one fist, or two fists like this, chin stacked on two fists. And you don't want to be too extended with the neck like this, just kind of nice, comfortable position. Whatever position of the three is most comfortable for you, stick with that position. For me, it's this position here. From here, all you're going to do is focus on your breathing. The breathing is deep belly breathing, 360-degree breathing, or crocodile breathing, so expanding equally on all sides of your core, on the sides, the front, and the back. 360 degrees all around your core on each inspiration. And on expiration, you're going to want to focus on the natural curve, the inward curve in the low back, this nice hollow here. You're going to want to think about this during exhalation. You're going to want to think about this area and allow it to sink into the floor with each exhalation. And that's pretty much the goal of this technique, which is gentle lumbar extension. So it can be very therapeutic for these types of patients. So again, just looks like this. Try this for 30 seconds. If it feels okay, continue for up to 3 to 5 minutes. And it feels pretty good. It's relaxing. It can also be a little chance to meditate, take a little break from your day. After you're done with the 3 to 5 minutes, just reverse the movement. So you're going to want the most important thing is reverse the movement by maintaining this nice natural curve that you've preserved in the low back. So push yourself up onto all fours. Again, maintaining the neutral lumbar spine. Walk the hands back. Pull the hips through. And then back to a lunge pattern. And back up to standing. So, tummy lie technique. Try it out. If right now, after doing it, you're feeling better, this is a strong sign that you have a lumbar disc injury and you've become flexion intolerant from a dynamic disc bulge. So, give it a try. Hopefully helpful. Thanks.